Hi guys, we're back with sessions 41 and today we're going to discuss clinical scenarios and review. This is going to be part 2 of what we discussed the last time, which was part 1. Diabetes mellitus, including patient education and misconceptions, and seizures, causes and taking quick action. These are going to be the topics of today. Well, as nurses, and of course diabetic ketoacidosis, which is a complication of diabetes. We all know that we all encounter diabetic patients as in the clinical setting. Some of them are cooperative, some of them are not. Here is Mr. Swanson, who has got very specific instructions and decides to defy the doctor's orders and the nurses when he asks for help. He wants something. He calls his wife and says, "Well, honey, I am really starving. I asked the nurse for a sandwich and she refused. Can you get over here quickly with my favorite treat?" Well, it's 2 o'clock in the morning. What is he doing having a sandwich at that time of morning? What do you think is going to happen to his blood sugar? It's probably going to go skyrocketing high. He obviously needs teaching. Then we have another patient here who's saying, Sam, he's saying to Dr. Johnson, "Dr. Johnson, I know you gave me a special diet, but I have a hard time giving up milkshakes and French fries." Without a doubt, Sam is going to have to change his lifestyle and his thinking, because at this rate, what do you think is going to happen to the diabetic patient who refuses to change his eating habits and follow the doctor's instructions? These are occasions that call for what is called patient education, to help patients understand that diabetes should not be taken lightly if they want it to improve. And next we're going to go to what is called diabetic misconceptions. Some people believe once they take insulin, that's a cure. It's as simple as taking diabetes. Well, this is not so. Taking insulin. This is what is called a misconception. And patients who receive insulin, they should be advised that it's not a cure. They need education to understand that insulin, when you take it, is a lot more serious than just balance. Some people think that they can eat whatever they want to and just balance it with extra insulin. Doesn't work that way. Please go to dearnurses.com. You'll find plenty of helpful information on this topic under diabetes mellitus in the clinical setting. Diabetes in the clinical setting. This is very helpful. Now, we're going to talk a little about diabetic ketoacidosis. And this is a condition, a complication of diabetes that requires very aggressive treatment. Again, you will find information at dearnurses.com. And it's important for you to know that these patients, their blood sugars become abnormally high. Probably they've not been managing their diabetes very well, and they virtually go into a coma. And of course they have to be brought into intensive care, their blood sugars monitored, and then you have to give them IV fluids. They're dehydrated and brought back to normal. It's quite an ordeal. So take the time to go and read that diabetic ketoacidosis case study. Now, the seizure patient. What exactly is a seizure? Well, for the most part, it's considered to be uncontrollable electrical outbursts of neurons, which are involuntary contraction of the muscles. And we can go on and on about, types of seizures. We've got the generalized type, that grand mal, and then we've got the focal type that's specific to one area, like the arm or face or so. Nonetheless, seizures have to be addressed. They have to be treated. The patients usually get managed on medications like Dilantin. Simplifying seizures at dearnurses.com will help you understand more. And what about the causes of seizures? Seizures may be caused by trauma. They may be caused by meningitis. They may be caused by tumors, subarachnoid hemorrhage. Many different causes. What's clear, if your patient was having a seizure, would you remember to secure the airway, turn the head to the side to prevent obstruction of the airway? There are things that you can learn from this. So there is valuable information there for simplifying seizures. Again, at dearnurses.com. If you take the time to look, there is a lot that you can find out about seizures and how to manage if you have a patient having a seizure. Well, I say have a great weekend, and again, stay posted for more helpful clinical information. Have a great weekend.